Well, the mouth is kind of the gateway to everything when it comes to health, when it comes to personal health and physical health. Dr. Frigo here with Frigo Orthodontics. Good to see you, sir. Thanks for joining us.
See you too.
So when folks that are watching maybe will need to have some orthodontic work coming up in the future, why should they choose Frigo Orthodontics? What helps you stand out in a crowd full of other folks?
Well, I think the difference is the learning I've had over the years. You know, I've learned from some of the best orthodontists in the world. I've traveled to Taiwan. I traveled to Madrid. I'm still going to a class in Madrid right now. And I think just the training I've received over the last 30 years has really fueled a lot of this opportunity to serve my patients with more information, more knowledge, and treat them with different plans that are more tailored to, you know, what they should get now. We're in the 2000s, you know, we should be treating patients a little better with our knowledge. We have AI, technology, we have a lot of benefits at our disposal. So what I do is I try to take all that I've learned and bring it to the Gulf Coast and make the treatments truly unique so that the kids have a great experience with very few teeth ever having to be pulled and no jaw surgery either. So I think that's the biggest thing right there.
Well, see, we were talking a little bit off camera, and what you didn't say just now was that who you're actually going to see when you're traveling internationally. You're going to see some of the best, if not the #1 orthodontist in the world. Well,
it started out, I went to a conference in Orlando, Florida, and while I was at that, and it was a conference for instructors in orthodontic programs. And at that conference, I met who became my mentor at the time. This was back in like 2014. It was Dr. Chris Chang, and he graduated from Indiana University with a PhD in anatomy, and he went into orthodontics. And he lectures all over the world, and he happened to be at this lecture. And I was looking at his cases, and he was showing cases that were clearly jaw surgery cases. At the time, we were using jaw surgery to treat these cases, and he did not use any jaw surgery. And so when I picked his brains, I met with him, and I said, "How did you do this?" And he said, "You really have to come visit my office, and I can show you how to do it." And so a few years passed by, and I traveled over to Taiwan, and I spent a few weeks with him working in his office and learning, picking his brain. And his background in anatomy really helped him create this type of temporary anchorage device that we now use commonly to help avoid jaw surgery. And you know, at the end of my meeting with him, I said, "This is amazing what you've taught me. How did you learn all this stuff?" You know, and he said his mentor was Dr. Ramon Pereira. At the time, I had no idea who the guy was. He doesn't get out and lecture a whole lot. He's mainly based in Europe. And so you know, my goal was then to seek him out one day. And sure enough, I've been working with Dr. Pereira for about the last 3 years now, going to visit him and learn from him as well.
Well, tell us about, you mentioned they're TADs, temporary anchor
devices.
Tell us about the TAD.
So a TAD is basically like a miniature implant, you know, that's temporary. So you're gonna place it and then you're gonna remove it. And in lieu of taking out teeth or doing jaw surgery, you place these small little implants in the very back of the mouth where nobody can see them. We use a light topical anesthesia when we place them, so the patients oftentimes don't even know we put them in. They don't even know what we're doing. We usually can place them in about, maybe it takes us maybe 30 seconds to put them in, and we can immediately load force onto them, so we can move teeth all over the mouth. So if you're missing a front tooth, we can move all your back teeth forward, and you said getting wisdom teeth out, that's pretty much everybody does that. Now what we do with the TADs is I move all the back teeth forward and make room for the wisdom tooth, and now we don't have to replace any teeth. I can put the lateral where the central was. I can put the central over on another side of the mouth. You can move them everywhere with those TADs.
And I mean, you mentioned with removing teeth, that is maybe a good fix today, but then 20, 30, 40 years down the line, then your face is changing structure and shape.
That's exactly right. And what exposed that to me was, you know, I started using a bracket called the Damon bracket, and the Damon bracket is specifically for mainly enhancing the face. It's not just straightening teeth. They're geared towards changing the face and supporting the facial tissues. And when you look at a patient, say a young lady gets 4 teeth pulled when they're 14 years old, where they're still growing and developing. And those teeth actually support all of the muscles of the face and all of the support systems of the face. And when they get to be in their 30s and 40s, and the teeth are no longer there to support that because they've been constricted, because you have to close 4 spaces where you pulled 4 teeth, it changes their whole face. And so when they're in their 30s and 40s, they're looking at maybe treatment alternatives like fillers and things like that to augment what they've lost by having teeth pulled.
Sure. I don't know if you can tell by just kind of looking behind us. This space is not your common everyday dentist office, orthodontic office. Should we go upstairs and take a look at some of your
Yeah,
space
absolutely. I'd love to take you on a tour of the office.
All right, let's go. And you're seeing now really just an aesthetically pleasing, this doesn't feel clinical. This whole building, it feels like you're visiting some family member's house on the beach, Dr. Frigo. It really is a stunning space. But on top of what you do here, in terms of the clinical side, you have so much more value added into your product.
Right.
Let's touch also on the length of treatment for folks, for kids who are parents who are wondering what that looks like because they've never been down this road before. What does that time frame look like?
So the American Association of Orthodontists, they put out like what is the standard time in treatment, and on average they look at practices. It's roughly around 24 to 26 months. I mentioned earlier the Damon bracket system that we use. It's actually taken off on average about 6 months. So our treatment times average around 18 months. Okay, and usually they average around 12 visits. So 18 months, 12 visits, you're in and out of treatment, and then we go into retainers and we deliver those retainers, and that's lifetime retainers. So they can lose a retainer as many times as they lose them. We're going to replace them. What do you think the value is in that? So
the parents can answer that question. The
Yeah.
parents that are watching right now that already replaced
Yeah.
4 or 5 or 6 retainers.
And that's why we started that. So we would get these kids that would come in that for another opinion, for a second treatment. They were already treated somewhere else. They've lost several retainers, their teeth shifted, and they wanted to get it fixed, So they would come see us. So we started saying, it's really unfair because these kids, things happen, they lose their retainer, and if they don't tell their parents they've lost a retainer and a week or a month goes by, the teeth are crooked now. And now they have to go through treatment again. So if we have a lifetime retainer replacement policy in place and they don't pay any extra for it, they can lose a retainer and come back to us without feeling any guilt or any kind of bad feeling because their parents have to pay $200 or $300 more, and they don't mind telling their parents, hey mom, I need to go get another retainer from Dr. Frigo. And that it protects the investment the parents have made in our practice.
And listen, kids, there's enough stress with kids taking tests and just going to school, just getting on the bus or getting in the car and just going to school, getting in the rider line. Like, I don't want to tell my mom that I lost a retainer because she already doesn't want to be sitting here 20 minutes in the rider line. It's more than just straightening teeth, right? It's overall quality of life. You're getting more with Frigo Orthodontics than you're going to get anywhere else. Dr. Christopher Frigo, thanks so much for being here.
Hey, my pleasure.
You see that information there at the bottom of your screen. You see the phone number, you see the website. Definitely, if you know that you're going to be in the market, if you're going to be looking into orthodontics, give them a call here. And what's it going to hurt?
And our exams are complimentary. So, and at the exam, we're going to teach every patient a lesson on how they never get a cavity. They can learn how to never get a cavity at that exam.
Awesome. Well, that right there is worth the price of tea in China, right?
That's right.
Awesome, Dr. Frigo. Thank you very much.
Hey, you're welcome.